All right, guys. So I'm doing this video. I had my doctor follow up, the one that administered the exosomes. And so I just kind of wanted to pop on here and just sort of give an update. Not necessarily an exosomes update, but sort of how the story is like shifting now. Um, I kind of do wish that she would be more direct in a way, basically say, this treatment failed or this treatment did not go as planned. If you saw my last doctor follow up, the last time I saw her, which was 3 months ago, I saw her in December. We got into this huge fight, and I literally had to push and push and push to get her to say that the treatment had not gone well, or that the treatment had not gone as expected. And I did get her to that point where she said, you know, that none of her other patients had this response to the treatment. Um, and then, she got angry, and she was, telling me, to leave, or that she did, that she was going to give me my money back, and that was it. And then she kind of like chilled out, and then she scheduled this appointment, this 3 month, follow up. Um, she told me at the last appointment, she goes, it can take a really, really long time, for these treatments to work. And I kind of was just like, does it take that long? I was really, I don't know if she was grasping or if she really believed what she was saying. Um, and then she was like, it has to work, it has to work. And I felt that there was sincerity in that. If you haven't seen that video, go and look at that video first before you watch this one. Well, now I saw her today, and it seems almost like she's sort of given in to um to what I had told her, because I had consulted with other doctors. I consulted with, a stem cell doctor, the guy, the vice president of the company of this product, and then with a naturopath, like with a lot of different people. And everybody was basically like, the treatment didn't go well, and you have a lot of gut problems. It sounds like you have a lot of gut issues. Um, so it was funny because now it seemed like she changed her tune. The one thing that I did notice was that she did not want to talk about the exosomes. Like, that was something that she kind of was trying to avoid, almost like pretend like it never happened. And it's really tough to do that because it has had such a huge impact. It has really, like, it's changed the course of my entire treatment and possibly even my illness. So I thought it was really weird that she really, and it's not like I was gonna fight with her. It's like we have to address the elephant in the room. So I don't know if she was expecting like that I was gonna walk in and there was gonna be some kind of a miracle, like, oh my god, I'm doing so much better, which I'm not. I'm doing even worse than I was 3 months ago. Um, and I might talk about that. I might do another exosomes update. Maybe in a couple months. But now she was kind of going with the gut narrative, that it's your gut and your gut has a lot of issues, and not necessarily saying that's why the exosomes didn't work. She was kind of avoiding the exosomes altogether and sort of skipping around, trying to keep me distracted. Like, she tried to give me these creams for my face, that have like stem cells in them, and she had already given them to me like a long time ago. This was a while ago. And I was like, yeah, I think you already gave me those and I couldn't use them. And she's like, are you sure? Like, she really was trying to keep me distracted and kind of, I guess, redirect or avoid us getting on the topic of the exosomes, which again, we can't. Like, we can't avoid that topic. Because, like I said, it's had a huge impact on everything, on my treatment options, on my body, on everything. So I did notice that shift, that she was now like, your gut, and I was mentioning to her all the things that have happened in the last few months, because a lot of things have happened. And now it just came down to my gut, and that, there's no way for stem cells or exosomes to like help the gut or to change the gut bacteria and that kind of thing. So, this is exactly what I've talked about in my other videos when I talk about stem cell clinics, and and sort of how they have these front loaded excuses when the treatment doesn't work. And they'll tell you, oh, it's your gut, or you're not following your diet, or it's stress. She did kind of try to bring up like the stress situation, um, which I don't deny. I am under a ton of stress. But this sort of, like, let's redirect it and look at something else, when she had so much faith in this treatment, even telling me that it was, going to get me feeling even better than, the IVIG and all of that. That narrative sort of shifted. And so to me, it was almost like she was, how can I say it? Like she was accepting defeat in a way, which was really upsetting to me, even though she admitted last time, like, yeah, things are not going the way that she expected. But at the same time, sort of her trying to avoid talking about it, or trying to, now changing the story to, yeah, it's your gut, which I was the one that sort of gave her that idea last time, because that's what these other doctors had told me. But like I said, these doctors have front loaded excuses for everything. When their treatment doesn't work, when these super expensive treatments don't work, then it's something else. Oh, it was something else. It's actually your gut. It's actually this other thing. Instead of just saying, it didn't go the way that I expected. Why? Why is that? Why did this not turn out the way that we had hoped? And I kind of wish that she was that kind of doctor where, she would ask that question to herself, ask me that question, or even ask this guy, the one that supplied her with this product, and say, hey, why did this treatment not go the way that I expected? Because she had looked into this product. She knows what my underlying issue is. And she felt that this product was going to get me, at least some improvement. And then we had this very unexpected response. So, yeah, I definitely got the vibe that she was kind of like, okay, like, this did not go well. Like, she didn't want to say it, but she was just like, oh, it's something else now. It's your gut. It's this other issue. Which, yes, that was the other mystery to me, and we discussed that a lot, because my gut has always been, an issue. Even since I was a kid, I've had, some gut issues. And my skin has always reflected those issues. And I told her, I said, my skin is doing unbelievably well given how my gut feels. And so, and I'm like I said, I'll do another video updating you guys on all of that stuff, because that's the part that's not making sense. And I told her that this is not making sense to me, because if my gut is really bad, if I'm still having issues with SIBO and all kinds of bacteria, because that was kind of the angle that she was going with, I'm thinking to myself, my skin would be showing that. I typically get really bad eczema, really bad acne, and that acne has actually cleared up beyond beyond what better than it ever has since the very, very beginning of my issues, which were, back almost 18-19 years ago. And my skin issues were one of the first, symptoms, very severe, acne skin issues, that I had never had before. So it's really strange. It was almost like she was trying to explain it, but not really. It was like, oh, well, the skin is getting better because the inflammation is coming down. But then I told her my neurological symptoms are worse. And she's like, oh, that's because you have more inflammation. So it's like, okay, is it that my inflammation go down, or did my inflammation go up? Because it just makes no sense to me. So, it did seem like she was sort of coming to a place of Like, this didn't work, let's move on. Which, again, drives me kind of crazy because she was like so sure that this would work. She was, she risked a lot. And again, she wouldn't risk so much. She wouldn't risk her license, her entire medical practice, even her own money. By the way, she did not mention anything about giving me a refund or giving me my money back. So I'm guessing she is not going to. And I didn't bring it up either because it's a tough situation, because I need her at the very least to run things by her. Like if I'm going to do another treatment with a different doctor, because we discussed that as well. It's like I need to run it by her because she would be the one to know whether I'm going to have a really severe reaction to it or not. I mean, at this point, I know that I have reactions to everything, but again, it's really, you know, I need her on my team. And unfortunately, if she's going to get angry or, if I'm going to make any kind of demands like that, because the product, I did use the product. There's no, I did consume the product in a sense. I can't give it back. And I know that if she gives me a refund, she's essentially paying for the product because I know she's not getting the money back from the lab. Um, so she would be basically giving me her money, almost as if she had paid for the product herself. So, it's a real, it's a tight spot. It hurts me so much that I lost that money. But at the same time, I kind of am thinking to myself, what else would I have done with that money? That money was not going to serve me in any other way, to be honest. It's not like I can buy a house, or it's not like I can, like I was going to buy an expensive car. I did get a car, but it wasn't going to cost me, it didn't cost me even that much, as I paid for the treatment. But I just kind of wanted to do this update because I feel like I kind of I don't want to say that it's closure. Like she just doesn't give me closure. Um, but I try to judge it by her demeanor and sort of how she behaves. That's sort of how I judge whether things are going well or things are not going well, or whether she's kind of thrown in the towel in a way. It seems like she has kind of just let it go, and now she's kind of going to shift her focus to my gut issues, or at least divert my attention to that, and point the finger at that and blame my gut issues for causing all of this mess. I'm not convinced. I'm not entirely convinced that it is my gut, because again, my skin is a huge reflection of my gut. And you guys can see I actually took my makeup off. I should have kept it on, but I actually took my makeup off, and look at my skin. I mean, obviously my camera, there might be like a little bit of a filter, but if you go back and look at my older videos, even the videos before I went on IVIG, I always had some kind of acne on my face. And then once I went on IVIG, the skin on my face cleared up a bit. But then you can see sometimes in my videos acne on my chest. And I did have backne, and then I had acne on my stomach as well, which was really bizarre. And a lot of that has cleared up. It's not perfect. It's not 100%, but it is beyond what the IVIG got me, because some of this acne was very stubborn. So I do, the gut issue thing, because she also didn't really explain to me why my skin would be clearing up, but my gut issues would still be really bad. It's almost like she didn't, she just doesn't explain things. And it's like, she probably just doesn't know. She probably doesn't understand exactly what is going on, you know, with this treatment, or what actually happened. Like, she doesn't know the specifics of it, why I reacted so badly, but also I'm having some benefits, I guess. So yeah, I wanted to post this because I know you guys haven't been hearing from me. You probably aren't going to hear from me too much because I'm going through this flare, which I do want to make a video about it, to discuss it because, again, if it's related to the exosomes, this is something to consider. If you have neurological symptoms or other symptoms, they can worsen. And I don't know if it's permanent. My rib cage is still acting up, but who knows? It could become permanent. And how do you undo that? How do you reverse that? Um, and you guys should be well aware of the consequences of these treatments because I'm not saying that we only hear the success stories, but I do think that stem cells and exosomes, especially now, exosomes are definitely marketed as something that, if it doesn't help you, it won't hurt you. And that was something that my doctor had also kind of told me. I mean, she actually told me it was going to help me, but that it wasn't going to hurt me, that I couldn't have a reaction to it the way that I could with stem cells, which is not true. And I'm starting to see that now, and doctors are telling me that now. But anyways, this video has gone on long enough. I hope you guys could hear me well because I'm a little bit away from the phone. I am in my room. So I will try to make more videos. I can't promise you guys anything because it's light sensitivity. It's been, I think, about a month. It seemed to be coming down steadily, and then right now it seems to be jumping back and forth. Like it doesn't know whether I'm not back at my baseline. So, and the light sensitivity can be very painful, but it can also be very, very limiting. Especially with my phones and stuff. So yeah, just stay tuned. Go back, watch my exosomes playlist, watch my previous update with my doctor so you can see how that went. Didn't go well. And she did schedule me for a follow-up in 3 months. So I'm going to see her again in June. I don't know. I kind of wish that she would tell me either I'll see you in 6 months or something like that. Why don't we check in 6 months because she's not seeing anything. So I do sort of wish that she would kind of, or at least tell me I'll call you if there's some other type of treatment or if something else comes up. Instead of sort of, I don't know if she's stringing me along or if she feels like she at least owes me this much. I mean, I'm paying for these appointments, or maybe she's waiting for me to go away on my own. But yeah, I am considering, possibly just not seeing her as frequently because it's not, we're not getting anywhere and she's not really offering me much. So I'm thinking possibly in the future, maybe doing once every 6 months or maybe just even once a year because there's really nothing that she has, with the exception of the exosomes. She told me, she says that's basically our last option. And I've presented to her other options. I talked to her about, plasmapheresis again and, Botox and muscle relaxers, and everything is just no, that's, it's, you're going to have a reaction, or that's not going to work, or that's not getting to the source of the problem. And I'm thinking to myself, well, we here, you and I, have not gotten to the source of the problem either. So, we may just have to treat symptoms until we figure out how to get to the source of the problem. So that's kind of the frustrating part, is that it's I can't do all of these other things. She's not on board with these other things, these other treatments. And she can't offer anything else either. So, she did offer me, I did get some kind of different probiotic type of thing. They're spores or something. So I'll probably do an update. I don't think it's going to go well, by the way, because I have tried some of these before, but I will give you guys an update on that as well. That'll be in the future. So I will do my best to bring you guys at least some videos, maybe one every other week, but I can't promise anything because of the way I've been feeling. So anyways, thank you so much. Please stay tuned, watch my other videos, and I'll see you in the next one.